Hi, everybody. What I would like us to look at today is how effective are masks in controlling viruses and diseases such as COVID-19. Yesterday in the video for the assignment, COVID-19, it said the most effective thing was washing your hands, social distancing. But during this pandemic, we have found that masks can be effective, but how effective are they? And you can see here the proper way to wear the mask, and we'll kind of go over why it has to go over your nose and your mouth. So I want you to take a minute though, before we go over this. What information, evidence, or incentive would you need to convince yourself to wear a mask properly? So I mean, even saying, let's say there's no government mandate, or maybe that is what would make you, but what are the things that would convince you to wear a mask? So I want you to take a moment. You can go ahead and pause the video and go ahead and write down in your journal some things that you would look at, some information that you would want, or things that you would want to know before you be like, yeah, I think I should wear a mask. Okay, so you can go ahead and take a moment to do that. You can pause. Okay, so let's kind of look at some of the different lines of evidence we have for masks. So first we like to look to laboratory experiments. So looking here, I'm going to click here, and I like to check where my information is coming from, and this is coming from the New England Journal of Medicine. And journals are really important in science because that means that other scientists have read through the research in the study and have said that this is reliable information. So not anybody can just post anything in a scientific journal. Other scientists need to read it and basically say that they trust the way that this information was gathered. So what they did here is that they looked at people talking, and then they looked at the droplets that come out. Now, these droplets can carry viruses such as coronaviruses. So what they're going to do is they're going to speak, and first they're going without the mask. And what they've done is they've kind of lit this so the little droplets will illuminate, glow green that are coming out of the person's mouth. So this first one is without a mask. Right, and we can kind of watch what's happening here.
Now I'm recording.
Stay healthy.
Great,
Stay healthy.
great. Less loud.
Stay healthy.
So you can see all those green things flying around. Those are respiratory droplets, and those respiratory droplets can potentially be carrying different viruses. So you can see without the mask that those respiratory droplets were kind of going everywhere. All right, so now they're going to try it with a surgical mask on, and we're going to look for those little green droplets again, because they could potentially be carrying viruses. So let's see what happens with a mask.
Are you recording?
Yeah.
Stay healthy.
Louder.
Stay healthy.
Louder.
Stay healthy.
Nothing.
So you can see that with the mask, very little of those respiratory droplets are going out into the air. So there's much less that can get out there to infect people. So we can see that those respiratory droplets are being stopped by the mask. Okay. And if you're interested in the rest of this journal, this whole thing kind of explains how they collected it, how they did this, how many times. So there's information about how they do that. And this is why we do lab write-ups, so people can see how the data was collected. So another thing that they looked at in laboratory experiments for mask efficacy, they call it, how effective a mask is. That's how effective something is called efficacy. So you can see that right there, efficacy. And here they did this in China, as people would come into the hospital and they tested positive for different viruses, then they would do these tests on them. So they didn't make them sick on purpose. They just looked for people that were sick anyway. And according to this abstract, an abstract in a scientific journal, again, this is the journal Medicine, Nature Medicine, and it's actually one of the most cited medical journals out there. So it says right here, and your abstract just kind of gives your basic data. It says, our results indicate that surgical face masks could prevent transmission of human coronaviruses and influenza viruses from symptomatic individuals. So if we go and look at the data, and I'll try to go through this kind of quickly with you. Here's what they collected for coronavirus. So here on this side, we have the virus copies per sample, and this is to the exponent. So what that means is, instead of like a linear scale like this, is that these numbers, as we kind of, every time we go up a power, they increase exponentially. So that's what that looks like there. Here's the nasal swab. So when they stick like a Q-tip up your nose, and these are the number of viruses you can get from there. And this is why it's really important to keep that mask over your nose, because look at how many viruses can be shed from your nose. Here's a throat swab, so a little bit less from your throat. Now here are the droplet particles without a face mask. Oh, let me scroll down just a little more so you can see. There you go. Without a face mask right here. So you can see those respiratory droplets. Again, they can carry the virus, and here with a mask. So for the coronavirus, we can see that masks are quite effective in reducing the number of viruses that are shed. So the first one, you saw the video of the droplets, and then here we're looking, they tested the droplets for the different viruses. And this one over here, we talk about aerosols. Aerosol is when the liquid evaporates from your respiratory droplets, like your spit and stuff. And then it can go into the air, and it can do that for a much longer period of time. And we can see without a mask right here, you can have some aerosol particles for the coronavirus. But again, with a mask on, you can see how much lower that is. So this is showing here that masks are quite effective in preventing the shedding of the viruses into the air. And if you scroll down here, they looked at influenza, and we can see that for the flu virus, the masks are, again, we see without a mask, with the mask, quite effective. Not as effective with aerosol particles. But for different viruses, there's different efficacies or effectiveness. And you can kind of see here, if I scroll down to the rhinovirus, depending on the virus, it depends on the efficacy. So without a mask and with a mask with the rhinovirus is not a huge difference. And you can kind of see there with this one. However, when they do the study for the coronavirus, we can see, all right, that masks can be quite effective in preventing those droplets from spreading. And that's the main transmission for coronavirus, is through those respiratory droplets. All right, once we look at a lab, all right, things work a certain way in a lab, but we need to go out into the real world to see if things really work in the real world. So here are some case studies from the real world, and there are links here if you want the whole journal articles. Again, when I look for scientific information, I look for scientific journals that have been reviewed. So I just don't look for anything on Facebook or anything like that. So this is where I got this information from, and this data here that I'm going to show you. So this is why I like graphs. It kind of takes all that information and puts it into a picture. So what they were looking at here is comparing the COVID-19 rates before and after mask mandates in 15 different states in the District of Columbia. And it found that mask mandates led to a slow daily growth rate, which became more apparent over time. So let me just kind of draw it on here for you. So this is when the whole community uses a face mask. So here was what was happening before. And then here's your community mask mandate. So having everybody have to wear them out in public. And you can see over time, you can see this decrease, right, of the growth in the community. Now, when let's say they put something in where it's only employees having to wear the face masks, you can see how the rates beforehand are here, and here's our reference point where they put the employee mask mandate in, but that means everybody else can still wear their masks. You can see that it still grew, right? And then there's a much, much slower decline. So we can see that community mask mandates, when people are following them, are quite effective at slowing the growth of a virus. And in this case, this is specifically COVID-19. Okay, so that's kind of in the States, the United States. Let's look, I didn't have a good map for this one, but they set out and studied 198 countries all over the world when this first started. And those countries that had cultural norms or government policies favoring mask wearing had lower death rates due to COVID-19. So we can see when we compared to other countries and countries that have that cultural norm or government policy for wearing masks, that they had much lower death rates than the United States. So we can see they're effective there. And then we have two particular case studies that really caught my interest. And one of these was on a plane. A person that was visually like symptomatic, had symptoms of COVID-19, was on a plane, and they were wearing a mask, the person with the symptoms who had tested positive for COVID-19. And they followed 25 individuals that were within 6 feet of him, including the passengers, the flights, the crew flight. And they tracked them, and only 5 of these people that were around this person who was positive became symptomatic, but when we're tested, we're all negative for COVID-19. So because these people were wearing their masks and the person that was infected was wearing their masks, as they followed them for 2 weeks after the flight, none of these people, besides the person who originally had it, tested positive for COVID-19. So they were all negative. So showing you that wearing masks can be effective in reducing that spread. And the last one here, so this one I have the scientific journal, again, kind of attached to that. This last one, this is the only one I don't have a scientific journal for, but here's kind of our last line of evidence. It says masks get credit for protecting a conservative community from coronavirus. So here we had 2 stylists inside a salon, and they were working there for about a week. So we have 2 infected stylists, and they had between them over 140 clients in close contact. So that's within a few inches or feet, you know how people do in your hair. And an estimated 200 to 300 more people had been in the salon. But they had people wearing masks. They wore a mask, and other people, they made sure that their clients wore masks. And after tracking all these people, they couldn't find a connection between other people getting COVID from them. So just kind of showing that people wearing their masks can reduce the transmission between people. So they can be quite effective. Are they going to be 100% effective? No. Okay, nothing is 100% effective besides like not coming into contact with anybody and locking yourself in your house. But it drastically reduces the number of people that get infected. So we have lots of lines of evidence that wearing your masks can slow the spread of coronavirus and COVID-19. Right. So we have laboratory evidence and we have case study evidence, several lines. So we looked at evidence that shows that masks can reduce the risk of transmitting COVID-19. So what are some risks of wearing masks? All right. So they're uncomfortable. It can be hard to talk, hard to read facial expressions, maybe some face acne, and harder to breathe. Now, compared to getting COVID-19, these are minimal things. I mean, even harder to breathe. Like right now, my brother's on a ventilator. He can't even breathe on his own. And how sick people can get. And again, we've had about, in the US today, about 582,000 people have died due to COVID. That's over 500,000 people. All right, so that's a lot. So here are some of the risks. I did hear this risk on Facebook. Someone had suggested that wearing masks causes an increased rate of teen suicide. And I was very interested, and I asked the person for the data on this. Any data that they showed me was not scientific data. So I went to the internet to find, okay, is there a connection between teen suicide and mask wearing? Now, I couldn't find anything scientific that suggested that. I did find, though, a couple kind of rates of suicide here. And you can see that these rates have actually been going up. I mean, the last 10 years or so, you can see the significant increase in these suicide rates between males and females over about the last 10 years. So like other things, problems in society is that a pandemic or a disaster can show where we're having some serious issues. And this is a serious problem, these teen suicide rates and the stressors that teens and things are going through. And I think that it's showing up more because of the pandemic. So just like you can see, racial inequities and poverty inequities and healthcare inequities because of the pandemic. They didn't cause those things, but we can see them now more because of the pandemic. I did look, you can see this stops at 2017. I did find a bit more current information comparing 2019 and 2020. And so here's the scientific journal here of pediatrics, which child medicine. And their conclusion is the rates of suicide ideation and attempts were higher during some of the months in 2020 as compared with 2019, but not universally across this period. So it's just kind of saying that there was a couple months, I think March and July, which is when we were on a lockdown. And that can cause lots of issues with suicide and suicidal thoughts. But again, I'm not seeing anything about where the masks themselves. But this is a really tough situation. And when somebody says that the masks are causing the suicide and that not wearing the mask is going to solve it, I feel it's a discredit to a lot of teens that are going through mental health crises, and that just saying that taking your mask off is going to cure them, which it's not going to. All right. And we can see that it's been rising for years. So obviously there's something else that needs to be causing that. All right. So I looked into that risk because someone had offered that to me. All right. So the last thing in making a decision if you would wear a mask if the mask mandate was removed is to look at the COVID data 19. How prevalent is COVID in the area that you're in? All right, so we've looked at, is it effective to wear the mask, the risks that mask actually would cause, and then we want to look at how much this is in your area. So we can look at something called the PVI, that's the Pandemic Vulnerability Index right there, and I'll show you through the United States. The places that are in darker blue have a higher vulnerability to the pandemic for lots of reasons, and they go through a whole way to rank these, which is really it's really interesting in itself, but also very time consuming. But if we zoom in here to Michigan and Grand Rapids, you can see this Kent County right here where we are is one of the highest vulnerability rates in the country right now. All right, and we can kind of see because of the transmission rates and the number of people that have it, right here is one reason. And here our social distancing and our testing isn't as high as we would like it to be. So we can see that for these reasons that there's a lot of disease in the community and our testing and social distancing interventions aren't as high as they would like them to be, that we are one of the highest vulnerable places, so most likely at risk due to COVID. So some other numbers to look at, and there's links here to the data. This is our Michigan data directly. If you want to look at COVID in Michigan, and this is at michigan.gov. And here we can kind of look at the state. And this can give you lots of data overall too, but you can even look just county by county. So I can click on Kent County, that's where Grand Rapids is, and it will take us through lots of data here. We can see that the Kent County, we've had some spikes. We've had 1, 2, 3 major spikes in COVID, and it looks like we're coming down from the last one. Some reasons: increased social distancing and mandates, things after this last increase, and the increase of the vaccine. All right, and we can see here a lot of demographics. We can see the number of deaths and cases of COVID over time. You can see how that's been increasing, and we kind of have these waves, 1, 2, and our third wave right after spring break there. All right, and here's what's interesting is cases by group. This has really shifted over time. So now you can see the 20s to 29-year-olds. This group is being affected the most. When this first started, it actually was over here. This had the most cases. However, now a lot of these people are vaccinated, so it's not spreading as fast through them. However, we are seeing an increase here in the 20 to 29 and 30 to 39-year-olds. So we have a lot of information there. And then also we can see over here our cases by race, and I want to go by per million because that's going to give me a percentage. And then you can see again here the Black African American, even though they're make up about 20% of the population, when we compare it per million, is getting those more cases of of COVID. And this can relate back to these social inequities and the systematic racism that's still apparent in the United States. Okay, I know this was a very long video, but I wanted to give you as much information as you could. Oh, and there is one more. This is the United States map right here. You can kind of go by cases, and you can look at these. But when it looks at hot spots in the United States, we can kind of see that Michigan are some hot spots in places. So they have data on all these. All right. So hopefully you have enough information and data, scientific data, to make your decision on, let's say that the mask mandates dropped, everything else remains the same, but the mask mandates dropped. Would you or would you not continue to wear your masks? And then why or why not?